Hello, and welcome to this Informed Dental Consumer presentation. I'm Dr. Beth Dorian. The purpose of this presentation is to first let you know how we know that you have a dental infection or an abscess, and to explain why it's important to treat it proactively, even if it's not hurting you at all. And finally, I'll explain how dental abscesses are treated. The reason we know that you have one is because we see a dark spot at the tip of your root. A dark spot like this one. Or occasionally the evidence may show up clinically. Sometimes we see what looks like a draining pimple on your gums. Either of these findings tell us that there are bacteria residing in your dental pulp, and that the infection has escaped the confines of that pulp and has destroyed bone beneath the root. It comes as a surprise to a lot of people that sometimes a dental abscess will have very minimal symptoms. It might feel a little sore when you press on the tooth, or other times it's completely painless. These are called chronic abscesses. Many people diagnosed with a chronic abscess wonder why they shouldn't just wait until the infection starts to bother them before doing something about it. And that's an understandable question. One thing to consider is the potential behind-the-scenes impact to your general health. While the systemic impact of gum disease has been more widely studied, there may also be systemic damage from chronic tooth-borne infections. It stands to reason your immune system is constantly having to maintain this low-grade infection, and pathogenic bacteria have access to your bloodstream. While these effects may not be physically discernible, they may cause issues with your health later. The extent of the potential health impact of an abscess while still in the chronic painless state is unclear, but it is worth considering. The more compelling reason to be proactive about treating your abscess is the potential for it to flare up into an acute infection at any time. Deciding to wait for the onset of symptoms is really rolling the dice. And that's because if and when the infection does flare up, it can be painful, dangerous, and tougher to treat. An acute flare-up of this infection could manifest as a painful toothache, or you could wake up one day with a very swollen face. If the infection has the opportunity to spread, you could land in the hospital. It doesn't happen often, but it does happen. And in extreme cases, people have even died as a result of a tooth infection. So it's not something you really want to mess around with. Another common question patients will often ask is, when do I have to deal with this? I'm going on vacation. I've just got too much stuff to do right now. I wish I could give you a definitive answer for this, but the reality is we have absolutely no idea. It is true that infections like this can lay dormant for many, many years, but one day it could suddenly flare up, and we just don't know when. There are scientists and academics out there trying to figure this out, but thus far there's been no magic bullet to help us make an accurate prediction. It does seem that the introduction of different types of bacteria into the infection can be a potential trigger, but of course there's no way to tell when new species of bacteria plan to join the party. Nor is it entirely clear what particular mix of bacteria will cause all the trouble. So the most sensible thing to do is to not let that trouble begin in the first place and treat that abscess proactively. How do we do that? There are only two ways: to do a root canal or to remove your tooth. If we think your tooth has a good long-term prognosis, then we may decide to treat it with a root canal. A root canal involves removing the infected pulp tissue, then cleaning and shaping this empty pulp space, and finally sealing it up with a root filling material so that the bacteria are kept out. With a successful root canal, your tooth will no longer be a source of infection. However, after the root canal is completed, your tooth may need a crown if it doesn't already have one. The crown will help to prevent your tooth from future cracks or fracture. Sometimes we will find an abscess in a tooth that has already had a root canal. And the reason for that is because there was still some pulp tissue remaining inside the tooth. The first root canal did not successfully eliminate the pulp tissue and seal the canal space off. In such a case, we can oftentimes redo the root canal and get a successful outcome. When a chronic abscess has been left untreated for a long time, and the root canal is only being done after the infection flares up, the prognosis for the root canal won't be as good as it would have been if it was done while the tooth was still in the asymptomatic state. And that's because the bacteria has had the opportunity to evolve into more virulent strains. If we expect that the long-term prognosis for your tooth is not very good, or if you have a no root canal policy, then the only other option to resolve your abscess is to remove your tooth. Of course, we do have ways to replace it, and your provider will help you determine the best way to do that. What about antibiotics? While it is true that we use antibiotics in some cases, antibiotics will never ever resolve the infection. Antibiotics are only used as a temporary measure. If you have significant swelling, the kind a stranger would notice, we usually give you antibiotics just to get that swelling down so that work is actually feasible. Or if you have significant pain but you just can't get your tooth treated for logistical reasons, maybe for another week or so, we will offer antibiotics to temporarily relieve that infection and hopefully reduce your pain. Unfortunately, though, antibiotics cannot penetrate the source of your infection, and that is why they are never curative. Your infection will eventually flare back up and possibly become even worse. And once again, we don't know exactly when this will happen. But if the infection has already caused pain or swelling, chances are it's going to come back fairly quickly. The only reason to offer antibiotics at all is if you have pain or swelling. There is really no reason to prescribe antibiotics if you have a chronic asymptomatic infection. So antibiotics are not the answer. Again, only a root canal or tooth removal will solve the problem. I urge you to take care of your asymptomatic abscess sooner than later. I hope you're now convinced that it's a bad idea to wait until it hurts. Thank you for watching.